Hello, class. Well, we're continuing on our lecture on the clinical care classification system and on nursing informatics. The first two sections did get at what is nursing informatics, what is informatics, and how it is used in our electronic healthcare records. I have provided an overview on all of the background, all the federal regulations that impact on where we are today. Now I'm going to talk specifically on the clinical care classification and provide you with an overview of why it is so important and it would make nursing and nursing practice so visible. The clinical care classification was one of the first nursing terminologies to be recognized by the American Nurses Association as early as 1992 when the study was completed. It was approved by the International Standards Organization called ISO as depicting the two nursing reference terminology models that are being promoted, nursing diagnoses and nursing actions. It was also approved by the HISB board and HHS secretary in 2007 and 8 as an interoperable nursing terminology. It meets the Semino criteria for an IT system, and the list goes on. The CCC system was developed at Georgetown University from a government-funded contract which mandated that a classification system for documenting patient care be developed. The contract project consisted of a national sample of abstracted records of almost 10,000 live, recently discharged patients from over 600 healthcare facilities. The study's 12-page abstract collected key data on healthcare services being offered in hospitals in this country. It also collected narrative statements of almost 40,000 patient problems or nursing diagnoses and over 70,000 nursing services, interventions, actions, or other activities provided by nurses to patients during episodes of illness. The lists of diagnoses and interventions were computer processed using keyword sorts and were statistically analyzed to get at what was important and what was the key variable or concept in each statement. They were analyzed separately, mapped to each other, and grouped into like categories. Finally, the selected concept lists were tested and used to code the live data from the survey study, which were checked for validity and reliability, resulting in version 1.0 of the CCC system. This illustrates how the nursing services to patients would be integrated in an EHR system. It demonstrates that nursing services, if coded and linked to support and complete the story of an inpatient episode of illness, would give nursing a great deal of visibility. The CCC system supports the electronic capture of discrete coded patient care data for documenting the essence of care that measures the relationship of nursing care to patient outcomes. The CCC system consists of two parts. The first part are the coded standardized terminologies for documenting nursing practice, and the second part is an information model or knowledge representation that outlines the 6 steps of the nursing process for documenting professional nursing practice. It is more than just a language. The CCC system terminologies consist of a 4-level framework which makes it possible to statistically aggregate care data upward as well as parse the data downward for an episode of care. Level 1 consists of 4 healthcare patterns psychological, physiological, functional, and health behavioral, which are used to categorize Level 2's 21 care components. Each care component represents a cluster of data elements that depict a holistic approach to patient care and used to classify and link the terminologies together. Note that the 21 care components represents not only body systems like respiratory and cardiac, but also it addresses functional activity such as activity or self-care, and health behavioral activities such as medication administration or safety requirements, as well as other categories to use to care for the whole patient, which is the role of the professional nurse. This illustrates the framework and the care components and qualifiers for each of the care components, which I will proceed and describe further. Level 3 and 4 represents the interactive nursing terminologies classified by the Level 2 21 care components to form a single system for documenting and linking diagnoses to interventions to outcomes. The 3 nursing terminologies were empirically developed and statistically analyzed. They consist of the CCC of 176 nursing diagnoses. A diagnosis is defined as a patient problem that requires an intervention to achieve an outcome. The CCC of 804 interventions with 4 action type qualifiers is defined as an intervention as a single nursing action to achieve a single outcome, that is one fact only. And the CCC of 528 nursing outcomes with 3 expected or actual outcome qualifiers are referred to as the care used to resolve the nursing diagnoses. And finally, the 4th level represents the 2 sets of qualifiers that I mentioned that describe a hierarchical structure for the concept for coding the concepts that are represented by the 4 action type qualifiers and the 3 outcome qualifiers. Please note that the terminologies are coded using a 5 alphanumeric coded structure similar to the coded structure of ICD-10. Each alphanumeric code is always the same length, and each digit analyzed and aggregated separately for statistical functions. The CCC codes are used to link to each other as well as map to other terminologies such as ICD, SNOMED, and LINC. Perhaps the CCC may even someday be considered the international classification of nursing informatics. Now let me turn to the CCC system's information knowledge representation model, which represents the second part of the CCC system, and which I will take up in the next section of this lecture.